First up, for the Food and Drug Administration announces the approval of a new COVID vaccine booster. Now, it comes amid an increase in COVID hospitalizations and concern about the spread of several new variants. The director of the FDA said this afternoon that the public can be assured the updated vaccine has met the agency's rigorous scientific standards for safety, effectiveness, and manufacturing quality. Now, the FDA's approval means vaccinators can legally begin offering the shot, but most will likely wait until the CDC can also weigh in. Coworkers, family members, or maybe even yourself are all coming down with the latest extremely transmissible variant. But as KENS 5's Jeremy Baker reports, the official COVID numbers may not be reflecting actual cases in our community.
For the discrepancy is likely because people are testing using at-home test kits, and if they are positive, many are not reporting it, resulting in lower numbers, and many are still not following the at-home kit instructions properly, with multiple tests needed 48 hours apart.
I didn't know that. I just happened to just take it again just to make sure that we knew if we had it or not.
Sierra Williams and her 2 kids came down with COVID in the past week. She did not know you were supposed to test multiple times at least 2 days apart.
That can be pretty confusing for a lot of people.
The CDC says if you are showing symptoms, you must test immediately. If you are exposed to someone with COVID, test at least a full 5 days after exposure. If you test negative on either test, repeat the test again 48 hours after the last test. For those with symptoms, if you test negative, consult a healthcare provider and follow safety precautions to protect yourself and others. But if you were the one exposed and the test was negative, then wait another 48 hours and test again for a total of 3 tests.
There's different kits out there, but most of them recommend that you take a second test 48 hours later if you're still having symptoms, because the sensitivity is not the best early on in infection for those home tests.
On their website, the National Institutes of Health says healthcare providers and laboratories have a well-established system for sharing laboratory test results, but there is no system for reporting at-home testing. When at-home testing results go unreported, public health recommendations made based on laboratory testing data may not reflect current COVID-19 levels. If you do test positive for COVID, it is strongly encouraged you contact your local healthcare provider to report it so the official COVID numbers can be as accurate as possible. Jeremy Baker, KENS 5.